Hi everyone, welcome back to another video. Today I will be sharing with you CMS proposed rule for calendar year 2023, Home Health Prospective Payment System Rate Update, and Home Infusion Therapy Services requirements. Let's dive right in. On June 17, 2022, the Centers for Medicare and Medicaid Services, or CMS, issued the calendar year 2023 Home Health Prospective Payment System Rate Update Proposed Rule, which would update Medicare payment policies and rates for home health agencies. Proposals and updates to the Home Health Prospective Payment System for calendar year 2023. This rule proposes routine, statutorily required updates to the home health payment rates for calendar year 2023. CMS estimates that Medicare payments to home health agencies in calendar year 2023 would decrease in the aggregate by minus 4.2% or minus $810 million compared to calendar year 2022 based on the proposed policies. This decrease reflects the effects of the proposed 2.9% home health payment update percentage, which amounts to $560 million increase, an estimated 6.9% decrease that reflects the effects of the proposed Prospective permanent behavioral assumption adjustment of minus 7.69%, which amounts to $1.33 billion decrease, and an estimated 0.2% decrease that reflects the effects of a proposed update to the fixed dollar loss ratio, or FDL, used in determining outlier payments, which amounts to $40 million decrease. Proposed permanent cap on wage index decreases. To achieve the policy goal of increased predictability in home health payments while aligning with proposals in the fiscal year 2023 Inpatient Prospective Payment System proposed rule and other proposed rules, this rule proposes a permanent, budget-neutral approach to smooth year-to-year changes in the pre-reclassified hospital wage index. Specifically, this rule proposes a permanent 5% cap on negative wage index changes regardless of the underlying reason for the decrease for home health agencies. Recalibration of patient-driven groupings model, or PDGM, case mix weights. Each of the 432 payment groups under the PDGM has an associated case mix weight and low utilization payment adjustment, or LUPA threshold. CMS's policy is to annually recalibrate the case mix weights and LUPA thresholds using the most complete utilization data available at the time of rulemaking. In this proposed rule, CMS is proposing to recalibrate the case mix weights, including the functional levels and comorbidity adjustment subgroups and LUPA thresholds, using calendar year 2021 data to more accurately pay for the types of patients home health agencies are serving. PDGM and behavioral assumptions. On January 1st, 2020, CMS implemented the Home Health PDGM and a 30-day unit of payment as required by the Bipartisan Budget Act of 2018. The PDGM, which Congress required, better aligns payments with patient care needs, especially for clinically complex beneficiaries that require more skilled nursing care rather than therapy. The law required CMS to make assumptions about behavior changes that could occur because of the implementation of the 30-day unit of payment and the PDGM. In the calendar year 2019 Home Health Prospective Payment System final rule with comment period, CMS finalized 3 behavioral assumptions: clinical group coding, comorbidity coding, and LUPA threshold. The law also requires CMS to annually determine the impact of differences between assumed behavior changes and actual behavior changes on estimated aggregate expenditures beginning with 2020 and ending with 2026, and to make temporary and permanent increases or decreases as needed to the 30-day payment amount to offset such increases or decreases. Additionally, in the calendar year 2019 Home Health Prospective Payment System Final Rule, the document citation is 83 FR 56455. CMS stated that they interpret actual behavior change to encompass both behavior changes that were previously outlined as assumed by CMS when determining the budget neutral 30-day payment amount for calendar year 2020 and other behavior changes not identified at the time the 30-day payment amount for calendar year 2020 is determined. In the calendar year 2022 Home Health Proposed Rule, CMS solicited comments on a repricing methodology to determine the impact of behavior changes on estimated aggregate expenditures. This calendar year 2023 proposed rule proposes the repricing method, which calculates what the Medicare program would have spent had the PDGM not been implemented in calendar years 2020 and 2021, assuming that home health agencies would have provided home health services in the same way they do under the PDGM compared to what actual home health expenditures were under the PDGM in calendar year 2020 and calendar year 2021. Using this method, CMS is proposing a minus 7.69% permanent adjustment to the 30-day payment rate in calendar year 2023 to ensure that aggregate expenditures under the new payment system or PDGM would be equal to what they would have been under the old payment system. While the law also requires CMS to implement one or more temporary adjustments to retrospectively offset for such increases or decreases in estimated aggregate expenditures, CMS also has the discretion to implement these adjustments in a time and manner deemed appropriate. Therefore, CMS is not proposing a temporary payment adjustment in calendar year 2023. However, CMS is soliciting comments on how best to implement a temporary payment adjustment estimated to be $2 billion for access estimates in calendar years 2020 and 2021. Comment solicitation on the collection of data on the use of telecommunications technology under the Medicare Home Health benefit. CMS finalized policy changes regarding the use of services furnished via telecommunications systems in the calendar year 2021 Home Health Prospective Payment System Final Rule. However, the collection of data on the use of telecommunications technology under the home health benefit is limited to a broad category of telecommunications technology costs under administrative costs on the home health agency cost reports reported at the agency level. This proposed rule solicits comments on the collection of data on the use of such services furnished using telecommunications technology on the home health claims at the individual beneficiary level. Collecting data on the use of telecommunications technology on home health claims would allow CMS to analyze the characteristics of the beneficiaries utilizing services furnished remotely and could give them a broader understanding of the social determinants that affect who benefits most from these services, including what barriers may potentially exist for certain subsets of beneficiaries. Updates to the home infusion therapy benefit for calendar year 2023. CMS is updating the home infusion therapy services payment rates for calendar year 2023 as required by law. Section 1834U3 of the Act specifies that annual updates to be equal to the % increase in the Consumer Price Index for all urban consumers, or CPIU, for the 12-month period ending with June of the preceding year, reduced by the productivity adjustment for calendar year 2023. The CPIU for June 2022 was not yet available at the time of this proposed rule. Proposal of all-payer policy for the Home Health Quality Reporting Program. CMS is proposing to end the suspension of non-Medicare/non-Medicaid data for home health agency patients. Home health agencies would be required to submit all-payer OASIS data for purposes of the Home Health Quality Reporting Program, or QRP, beginning with the calendar year 2025 program year. Baseline years in the expanded home health value-based purchasing or HHVBP model. For the expanded HHVBP model, CMS is proposing to add definitions for home health agency baseline year and model baseline year and remove the previous definition of baseline year. Change the home health agency baseline year from calendar year 2019 to calendar year 2022 for existing home health agencies with a Medicare certification date prior to January 1st, 2019, and from 2021 to 2022 for home health agencies with a Medicare certification date prior to January 1st, 2022, starting in the calendar year 2023 performance year, and change the model baseline year from calendar year 2019 to calendar year 2022, starting in calendar year 2023. Health Equity Request for Information or RFI. CMS is seeking stakeholder feedback on their work around health equity measure development for the home health QRP and the potential future application of health equity in the expanded HHVBP model scoring and payment methodologies. Hope you found this information useful. If you enjoyed this video, please consider subscribing to my channel. Thank you for joining me. Bye now.